being able to have a surgeon and a team walk you through what it may look like if you don't have the surgery was really helpful for us. And we were actually, I feel we started thinking about surgery about 8 months to a year before we actually had it. And we were, I think, getting close, if not at that window of it becoming a problem if we waited much longer. And I just remember us having a conversation that fully supportive of whether we do it or not, but also sharing that window was closing where it would become much more complicated and a much more stressful surgery for Will if we waited.
Yeah, phrasing it as a window of opportunity, I think that's probably the right way to do it. It's a window of best opportunity. And if it's much too early, it's not obvious that you need to do something, and it's after that window, it just gets much, much harder and less satisfactory.
And having that surgical date also turns up the heat a bit, I think, in terms of, we have a stop point here, and we want to try to optimize the children's health as much as possible ahead of that time. And, if you've got a couple months involved, you have to move pretty quickly in order to get through that. Often, I think sometimes just having the surgery leads to this comprehensive health assessment for some children that detects things that have kind of silently been there, but haven't been really explicitly called out as a chronic health problem, which really changes the family and the provider's perceptions of the children's health. So sometimes we uncover severe central sleep apnea, or we've even had a recent case of a kid diagnosed with inflammatory bowel disease as part of the workup for spinal surgery that was just sort of sitting there. And then that changed everything in terms of thinking, and it caused everyone to take a step back to say, okay, well, hold on, we have to think about that, and then in the context of spinal fusion, whether we should do it or not. But it was the surgical date and knowing that was upcoming, which really forced everyone to more proactively think about the children's health to make sure that things were all set, which led to those discoveries.
Can I just share along those lines, an example of that was, we made the decision to actively move forward, and I scheduled appointments with every specialist, I think between the time we were kind of making this decision and the surgery, just to have people's check-offs. And I don't think we were emotionally prepared to go to the neurosurgeon and have him give us a pause and think, he hasn't had a shunt revision. This has been in there for a very long time. We need to make sure that this is working before, he goes through this major surgery. And we were just like, really caught off guard that potentially we need to consider if maybe we would put him through additional surgery in order to reach spinal surgery. Thankfully, the situation was such that they were able to do a shunt tap and find out that, remarkably, after all this time, it was still functioning properly. But there was definitely a pause and a need to evaluate, and it potentially could have changed our course and our decision if things had been different.